Good morning, Rotarians!
From our studios in Kennett Square, Pennsylvania, it's the Longwood Rotary Club Home Edition on Thursday, April 30th, 2020, normally meeting at the beautiful, world-famous Longwood Botanical Garden. Guests today are Matt Grieco, Steve Maley, Dave Foresman, Rob Newman, Vicki Gehrt, and our very special guest, Matthew Eich, EMT Chief at the Longwood Fire Company. Plus, another very special four-way test presentation from Cailen and Sophia Maley. Please welcome our host for today's meeting, Longwood Rotary Club President, Bob Curran.
Good morning, Longwood Rotarians, and welcome to the Longwood Rotary Club's online home edition for Thursday, April 30th, 2020. We've got a great show again this morning. We've got Matt Grieco, Steve Maley, Dave Foresman, Vicki Gehrt, and our special guest speaker, Matthew Eich with the Longwood Fire Company. Now let's go right away to our thought of the day, Mr. Matt Grieco.
Good morning, Rotarians. Matt Grieco here in sunny Quakertown, Pennsylvania at my new funeral home. Good to be with you, albeit from a distance. Like all of you, can't wait to see you again soon. So as you can tell, my wife had a little fun with my head recently with a #1 clipper, and don't try this at home. I've been told that the hair will grow back. That's a good thing. So I bring you my thought of the day for a little inspiration. It goes like this. Nothing in life is to be feared. It is only to be understood. Now is the time to understand more so that we may fear less. That is my thought of the day. See you, buds.
Well, thank you, Matt, and for that thought of the day. And now we're going to take a minute for Rotary Moment.
Oh, Dave, let me turn the music down. Caught me kind of off guard there. So I'm just getting ready. Robin and I are doing a little planning, a little day drinking for our favorite holiday of the year, Cinco de Mayo. It's coming up this weekend, you all know. I'm sure you have your own plans. We love it. It's a great way to open the summer season, and it's my favorite holiday because there's no tree, you don't have to set on any cards, there's no packages to wrap, there's no thank you cards. The only thing is the dull ache of regret the next day of, what you all did. So the pool is open and running, looks great. Margarita Matt's gonna be here from Delaware with his machine. It's a beauty. And we're gonna make a little late night run across the border to Total Wine. We need a little bit of tequila. This should keep the federales away. We've gotten the groceries. We've got limes and avocados. We're already with that. We went and got some tequila. We brought this back when we went to Cabo. This is from Hotel California. I'm looking forward to trying that one. It's going to be a great one. I think we have everything we need for the party. The only thing we have too much of course, is too much damn Corona and not enough of you guys. So we're just going to push back the plans. It's going to be the Cinco de July, and we look forward to seeing you then. So hope you have something planned. Celebrate safely, and we'll see you back at Longwood really soon. Adios.
And thank you for that Rotary Moment. And I also want to thank Dave Harrinan for all his production skills with bringing you these meetings every single week. A couple items going on in the community. We've had great collaboration among all the giving organizations, so we can cover as many organizations and agencies as possible. The leadership are all talking to each other, knowing where the donations are going, where there might be some gaps, and trying to fill those gaps. Your foundation, led by Vicki, is really well involved with the leaderships in the community and is taking the appropriate actions. Also going on is the Square Roots Collective, and they are looking for volunteers for the month of May. And to sign up, go to www.sccnetwork.org/community-response. And this will get you on the volunteer list for the activities, mostly in the food collection and distribution area, but they have other things going on as well. So be sure to sign up for those slots for May. They're looking for at least a 3 to 4 week commitment one day a week, one afternoon a week. It'll all be laid out in the at the website.
Greetings, fellow Rotarians and friends who are viewing this week's Longwood Rotary virtual meeting. As President-elect and President of our Longwood Rotary Foundation, I was asked by our Foundation Board of Trustees to provide you with an update on Foundation activities and actions. Before I do, I want to take this opportunity to thank the Rotarians who make up the Board of Trustees. Thank you to Jose Colon, Brendan Murphy, Christine McDonald, Dawn Talley, Bob Listerman, Bob Curran, and non-voting member Rob Newman for the time, commitment, and valuable input they provide for the decisions that need to be made for our foundation funds. A special thanks to Bob Listerman for his skills as our treasurer, and to Bob Curran. Thank you for your exceptional leadership as our club president through these unprecedented and uncharted waters as we continue to connect with our members and our community at large and provide for needs that arise. The Foundation Board of Trustees wanted me to share where we are with the grant approval process, and I will conclude with an overview of the Foundation budget and include financial status of our canceled gala. The trustees made the determination at the April meeting to only consider funding grants to community organizations attempting to provide assistance to members of the community affected by the coronavirus situation. This is a temporary decision. As you will see shortly, we have funds that can be used to help those in need. Another decision made by the trustees was to establish a separate line item for the direct donations related to the coronavirus within the community. A few individuals have asked to donate their federal aid check for that purpose. This enables others to do so, if they elect to do so. Let's take a look at our foundation budget that you now see on the screen. Currently, we have $104,368 left in our budget, and estimate by June 30 of 2020, we should have $90,000 to $100,000 depending on what grants we provide to assist with community needs. We have spent approximately $64,339 for current year grants and scholarships. We will not receive any revenue from the 2020 gala since we had to cancel. Our losses due to the cancellation of the gala equate to approximately $3,200. We provided refunds for tickets, sponsors, and ads, and Longwood Gardens returned our large deposit for food and for use of facility for about $27,000. And thanks to Bob Curran, reimbursed us for a check for $12,258 for our crosswalk greeting assistance we engaged in this previous holiday. The 2020-21 Longwood Rotary Foundation budget will be developed shortly by Rob Newman, who will be the new president-elect, and me, along with the assistance of Bob Listerman. We will be taking into account that we do not have the revenue sources from our annual gala fundraiser. Deliberations will be underway regarding fundraising opportunities for 2021 to include a 2021 gala and what action will be taken with items that would have been in the silent auction. We will keep you, our Rotarians, apprised as this deliberation occurs, and we truly, truly encourage you to share your views and ideas with us. Before I close with two final items, I want to thank Jackie and Nancy for their dedication, energy, backbreaking work in putting our 2020 gala together. Also, thank you to other Rotarians who assisted in organizing and preparing for an anticipated event that could not occur. The two final items. Just an FYI that we applied and received matching funds to assist the Kennett Food Cupboard from the Gundaker Foundation. Our foundation provided $1,000 that was matched by Gundaker in the amount of $1,081. We are also going to submit a Rotary grant asking for funds to help train Kennett parents in the use of technology that will enable them to better assist their children, provide for additional hotspots for internet access, and Chromebooks to use for the training. Wishing you all good health in the upcoming months as we transition and adjust to what I believe will be the establishment of new norms in our lives. Peace be with you all.
So now we're going to take you to our member spotlight of the week with Mr. Dave Foresman.
Good morning, Rotarians. I hope you're safe and healthy. And I'm looking forward to the day when I can greet you properly at Longwood Gardens. I'm happy to tell you a little bit about me this morning. I'm very honored to be a charter member of this club. But my Rotary history started back with Tom Zipper some 40 years ago, when Tom invited me to a meeting of the evening club in Kennett Square. I wasn't quite ready to join yet, so it took a long time. But I have to credit Tom Zippers because he invited me several times to come to the meeting. Anyway, I was born on Pearl Harbor Day, 2 years after 1943. In Lewisburg, Pennsylvania, home of Bucknell University, right along the Susquehanna River in central Pennsylvania. But I graduated from Milton High School, just up the river a few miles. Now that's also famous in our club because of Kathy Renko, who graduated from Milton High School many, many, many years after I did. I went on to Penn State University to study ornamental horticulture. And when I was a young man, I became very interested in plants and horticulture and anything outside. I worked for a greenhouse business in Milton and went on to study horticulture and graduated from Penn State. At that time, I met Dr. J. Franklin Steyer, who was a resident. He was a Quaker and a resident of Chester County, and an avid Penn Stater, and he hired me to come down and work at his nursery, which I did for several years. I went into the United States Army Reserves and was on active duty when my son Jeff was born. I was out in Washington State serving our country when Jeff was born. I came back from active duty and went to work for Longwood Gardens. That was 1966. I spent 33 years at Longwood in the education department, where I managed student programs, interns, high school programs, the international program, and also managed all the housing, 50 units. We could house 50 students at that time on the premises. In 1970, I had the honor, we actually started working on the professional gardener program several years before, and I helped to found the professional gardener training program, which is now world renowned. It has changed quite a bit, but in June of this year, it will be 50 years old. I left Longwood in 2000 and went to work for the Brickman Group. Recruiting in the northeastern part of the United States. Brickman is the second largest commercial landscape company in the United States. And when they sold the company in 2014, it was sold for $1.2 billion. Huge company. But I learned a lot from working with a company, and Roseanne and I decided that I was having so much fun that we'd start our own business, Green Industry Consulting. And we've been in that business now since late 2014. My main business is talent acquisition for the green industry in southeastern Pennsylvania and Delaware. My hobbies are cooking, gardening, obviously. I love to read and I love to hunt. I have two children. I mentioned Jeff. He's an executive chef at the Weston Riverwalk Hotel in San Antonio, and Kim works for Lexus of Wilmington. In 1987, I married my high school sweetheart after a reunion of our high school class, our 20th high school reunion. We came reconnected again and got married in 1987. She's the love of my life. Her two sons, Matthew works for Hilton, HR World Director, and Brian has a commercial construction company in Tucson. I love being a Rotarian. I really do. We are the greatest Rotary Club in the world. Stay safe, my friends.
Thank you, Dave. Now we're going to take you right to our Sergeant at Arms, Mr. Steve Maley.
Well, good morning once again, everyone. And to start off the day, for me today, I have to say I have a confession. Among the long list of indecencies this pandemic has imposed, one near the top of my list is the absence of baseball. I miss baseball. And listen, I miss baseball, and I have to watch the Mets. But is there anything really more summer than baseball? So let's do some baseball jokes this morning. Did you guys know that baseball is the first sport in the Bible? Yep, it says it right there in Genesis. In the beginning. A rookie pitcher was struggling at the mound, so the catcher walked out to have a talk with him. And he said, I figured out your problem. You always lose control at the same point in every game. And the pitcher says, when's that? Catcher says, right after the national anthem. Finally, while researching for this week's jokes, I came across a comedian who said he knows why Pete Rose is not in the Hall of Fame. He says that Pete probably was sitting in some bar and told some guy that he wouldn't make the Hall of Fame. And the guy turns to him and says, you're crazy. You're Pete Rose. You got all these records. Of course you can get in. Pete says, bet you $1 million I don't get elected. All right, well, it's my pleasure to introduce this week's speaker, Matt Eich, Captain of Emergency Medical Services for Longwood Fire Company. Matt is an 18-year veteran of EMS, is Captain of EMS for Longwood Fire Company, a role he assumed in February of 2018. In his role, he has total oversight of the fire company's ambulances and emergency medical services and manages a staff of over 40 career and volunteer EMS staff. Matt began his EMS career in 2002 and became an emergency medical technician in 2003 and a paramedic in 2008. He began at Longwood as a staff paramedic part-time in June of 2010, took a full-time position in January 2011, and was promoted to one of 3 EMS lieutenant positions in 2014, which he held until his promotion to captain. Matt also serves on the Chester County EMS Council Board of Directors. So we're very fortunate to have Matt with us today to speak both about his role and the challenges confronting Longwood Fire Company and EMS more broadly during this current health crisis. And following Matt's presentation, our behind-the-scenes producer, Dave Harridan, will then host a Q&A with Matt. So with that, I'll turn it over to Matt. Thanks for joining us.
Hey everyone, thanks for the opportunity to present to you guys today. Got the opportunity and the ask from the Rotary to provide some information and kind of give you guys a status of where we stand as far as Longwood Fire Company as one of the first responders here in the Kennett community and the Kennett, Longwood, and outreach community here. So I really do appreciate the opportunity. I like being able to do these outreach things, to be able to present to people and kind of give people more knowledge about what's going on, here with current events. Obviously, the big topic on everybody's mind is, the coronavirus or COVID-19. They, we're all consumed by it. It's in the media. It's, everywhere you look. So it is obviously affecting things here at Longwood. I appreciate that, Dave and the guys from the Rotary gave me the opportunity to present to you. So I'll just kind of wind back all the way to when we first heard about this thing. We got some situational awareness reports through the Chester County Department of Emergency Services, through the Department of Health. Put it on our radar. We obviously saw it on social media and saw it on the news that, China had this unknown virus that started in a fish market or whatever. But it was on the other side of the pond. We weren't super worried about it. We kept it a little bit on our radar. One of our founding, partners and the reason that Longwood Fire Company exists is Longwood Gardens. So really the first thing that even kind of got put on our radar was the tourism that they get. So that kind of made it maybe a little bit more real for us that we may see something with, the people that travel from all over. They come over there to see, the events and the presentations that are there. So I had some really early on conversations with their public safety about that. But really beyond that, that was really, if I wind back, 2 or 3 months, that was, kind of the only way I thought I would ever see this thing anywhere in my 6 municipalities that we cover for the EMS side and the 4 that we cover for the fire side. If you rewind, obviously, towards the end of February, that significantly changed. There was cases in the United States, cases getting closer. New York started to have the big pandemic situation that they have. New Jersey obviously had a lot. Philly was getting some cases, and I don't remember the exact date, but eventually the president announced that this is now a national pandemic and that we're all going to be dealing with this. So that really shifted gears for me in a leadership role as the captain, and for AJ McCarthy, our fire chief. We sat down and we said, we really need to plan for this thing and figure out what we're doing. So internally here at Longwood, we made some really early, immediate steps. We closed our building off to any outside public. We canceled all of our training, and we did that right around the first week in March is when that conversation started happening. We put that announcement out, and it took not as long as we probably thought. But originally, we had some skeptics, even within our ranks that thought, oh, we're blowing it out of proportion, or maybe it's not here yet. Do we really need to cancel everything, cancel all of our trainings, that kind of stuff. Fast forward, a week or so from there, clearly, we made a good decision. So this obviously has become a new norm for us. It's all this time we've been trying to get our volunteers to come and hang out at the station so we can get trucks out quick and all that stuff. So it's a big difference to, as the leaders of this organization, to say, we don't want you here anymore. We want you to stay home. If you're going to come here, it needs to be a very small group of you. It can't be, 20 guys hanging out. This time last year, we would have begged for 20 guys to be hanging out. If there was a call, we would have dumped every truck in this station plus some within a couple minutes if we had 20 guys here. So, this has been a different animal for us. I do want to reassure the whole community, our ability to provide service on the EMS or fire protection side has not changed whatsoever. We're still available 24/7, 365. We have dedicated crews. We have career staff that are here during the day for both fire and EMS. We provide, basic life support transport and advanced life support transport service. We work collaboratively with Kennett Fire Company as the paramedic for their area that supplements those higher acuity calls for the BLS. And none of that has stopped despite all this stuff. So that there is that reassurance. Some things that changed for us have been the amount of dispatches we have. As the governor orders started to come in to stay home, we've seen less volume, which you would think is it is a good thing. Hopefully that means people are being safer. There's less traffic on the roads, so I think that cuts down on the traffic accidents we see. So we do have all that going on. In this immediate area, we have, I think, close to 36 confirmed cases. I'm not violating anything on that. That's public facing. There's a website that posts all that by township and percentage of population. So anybody, is able to look at all that stuff. So we keep a close eye on that number. We make sure we have, we do that for a preparedness standpoint. So we have the correct PPE we need. PPE is a good discussion in and of itself. A lot of the media coverage is surrounded about, nurses not having enough PPE or PPE being short. Here at Longwood, we, early on, we tried to get, kind of as much as we could. We didn't want to be greedy and stockpile way more than we were going to need, but we wanted to make sure that, our guys were going to be able to be safe and we're going to stay healthy through this whole situation. So we've closely monitored that. We do inventory, on everything within the building, probably 2 or 3 times a week, keep a close eye. Another big difference of all this is, we had to fund all that stuff. So, you don't always think about this as a business, because it is a public service, need or requirement. But there's dollars that it costs to pay for all that stuff. So it was a big impact for us on the additional, line item budget to have significantly more PPE than we probably have used in 3 years, that we had to purchase all of a sudden in the first quarter of a year, which is normally a slower, a lower income or revenue time for us. So that's been a challenge that we've navigated and faced. We were able to secure some grants for that. The CARES Act, we're still working to continue getting the payroll protection loan and all those other things that are available to try and help, make sure we can continue to not have to dig too much into reserves, not have to lean on the municipalities to, do anything with tax money or anything like that. So we're certainly doing everything we can to ensure that the community, you guys are safe, that, our guys stay healthy. We've had, a couple guys that have been out and back for quarantine and stuff already, but fortunately we haven't had, a big amount of people. It's been, maybe one person at a time, which has been good. Looking forward, I would say, my biggest fear with all this is the staffing. EMS providers especially are very cross-pollinated, we like to call it. So, career staff here at Longwood probably also have at least one, if not 2 or 3 more jobs. So they may also work at, Avondale or Oxford or somewhere like that. So if we have, somebody that gets sick at any of those places, one EMS provider, EMT or paramedic that gets sick, doesn't just affect, here at Longwood, but it easily will impact 2 or 3 more agencies for however many hours they normally worked per week or per month. So if we saw a big outbreak within the EMS community, that would be, that could lead to less service being available or a station being put out of service. Early on in this, before we had a lot of information, Lower Marion Township EMS and police department both had, in the double digits of providers quarantined, which was a huge impact. I mean, here at Longwood, we only have, roughly 40 employees. So if we lost, 20 employees, that's half our workforce. That would be really impactful to try and keep, both ambulances in service. On the volunteer side, same thing. We've had some volunteers that because of their full-time job, they were restricted. So they aren't able to do anything other than their full-time employment and go home. They can't volunteer or work anywhere else. So that's impactful from our volunteer workforce standpoint. If you have a guy that's, normally fairly active and one of your, mid to top responders, and now because of his restrictions from his full-time job, not being able to respond, that's, obviously a big impact that we had to absorb. I think we're week 6 into this technically, as far as the national, pandemic or the national emergency. So as we continue, stress levels are getting high, and that's everybody. That's us, EMS providers, police departments, hospitals, nursing homes, everything. So that's another challenge that we faced. We've been going to nursing facilities that have positive cases, and the stress level of the nurses are high, fuses are short, and that can certainly lead to, a frustration overload or a little bit of a boiling point that could be reached, and isn't productive for anybody. And, we know that it's not, it's not anything personal. It's because they're stressed, they're overworked. This is a whole new, unknown. All of our providers are concerned on the volunteer and the paid side that, they're going to get exposed, they're going to take it home, and it'd be one thing if you interacted with the patient and you were sick, by the time you're driving back from the hospital or by the time you're driving back from the fire call, but that's not the case. And, in some cases it can take up to, can take the better part of 2 weeks before you notice. So think of the amount of people that you, in your day-to-day, even in this new quarantine time, that you interact with in a 2-week period. You stop at the grocery store, fill up gas, go home and eat dinner with your family. So if you do that multiple days in a row and then you turn out to be sick, think of the stress level that gets added on from that with, now your wife's sick, your kids are sick, it's your fault because you brought it home. That's something that the career staff, I think, are acknowledging because they need the money, they need to work. But on a volunteer side, that's a big ask for somebody that doesn't collect a paycheck. So, AJ and I have been really keeping close eye on our volunteers, and we do a weekly meeting each Tuesday night in place of what used to be our in-person training, where we just have a discussion. We talk about kind of some updates, where we are with cases in our area, any new initiatives from the county or the state, and then we just open it up and we let people talk. It's kind of almost like a little bit of a, like a stress management tool where we give people the opportunity to talk about stuff that might be going on, suggestions on what we can do, fun things you can do at home to kind of decompress and turn off the everything COVID, 24/7 that everybody's thinking about to try and manage this. I think in general, right now, our spirits are way higher than I thought they were going to be. I'm extremely proud of our team here at Longwood. My staff has been phenomenal. They've been, dealing with my craziness of sending, almost daily memos out with a complete change from how we did things 3 days ago. And, on Monday, I tell you to wear, the simple surgical mask, and on Wednesday, I'm telling you to wear a face respirator. That's a big change to keep up with the this ever changing environment. But our career staff has been stellar. They've been completely adaptable to everything that's going on. Our volunteers, we've not seen anybody that's stopped coming to calls or turned away. Everybody's just embraced that this is another thing that we need to do. We need help. People need help. We need to make sure we're there when they're needed or when they need us. And everybody's been unbelievably cooperative and helpful through this whole thing. So I'll see if anybody has any questions, or if Dave has any questions on anything I may have missed.
So let me ask you this: what's the next couple months look like as far as your radar? Because we see all this stuff on the media, everything, but here in the trenches and in reality for our area, what's your future next couple months look like for you?
Yeah, that's a great question. So I'm skeptical to try and make a prediction for sure, but I do think this is probably not that we're not going to just flip a switch and go back to normal as we know it on January 15th, for example. I mean, there's no way that's going to happen. Looking at the data and the numbers here in Chester County, we've been jumping really small increments in confirmed positive cases each day, which is very, very hopeful. I do a conference call once a week with the hospitals, and there's been a couple big deal patients that were on ventilators that are better and got discharged. So that's really hopeful. Governor Wolf yesterday put out that new kind of reopening plan or platform with like the red, yellow, and green concept of reopening. So I think, I'm hopeful that Chester County probably is already in that yellow. So we're hoping that maybe that May 8th might be the last, push out that we see, and we might be able to get some semblance of some reopening started here. Obviously, don't quote me. I'm not a Department of Health doctor or anything like that. I just, I look at the data, and I do think that although we're still taking we're still taking cases, we're still taking people to the hospital, I think in general, we're seeing small jumps, which is huge. I think the social distancing is extremely important. I think everybody needs to kind of embrace some of this stuff we've been doing for a little bit. And if we do a partial reopen into that yellow phase, don't immediately go out and start hugging everybody that you see and handshaking everybody you see. Keep social distancing, keep wearing your bandanas and your masks when you go out for that source control. So not when you're talking, you're not spitting anything out or projecting any germs or with a cough or a sneeze. if you can find hand sanitizer, use it. I think if we keep these practices up, into or even through summer, I think we can have some semblance of normalcy back, just with a little bit of a variation than what we're completely used to.
All right. Well, as memory serves me right, you were headed to visit the actual Longwood Rotary Club meeting here about the day that this all started to hit.
I was, so I could probably, whatever that Thursday was, I was planning on coming, and our no outreach initiative started, I think that previous Tuesday. So, unfortunately I missed it, but I'm definitely looking forward to once we can get. I'm not a big morning guy, but I will. I think this is worth it, and it's a good cause. So I can drag out of bed on a Thursday morning early one day and head into my backyard here at the station and come hang out with you guys.
That sounds great. I know I speak for certainly everyone in our Rotary Club and everyone in our community and our county, just around. Our thanks to all that you all have been doing and all that you I know will be doing. Take care of yourselves. Be safe. Take care of those families that you've got, because they depend upon you as well, and as we all do as well. So thanks for everything, Matt. I really appreciate you taking the time today to be with us.
Absolutely. Thank you, Dave.
All right. We'll be in touch. Thank you so much.
Take care.
Well, thank you, Matt. Great presentation and, very timely. Now we're going to take it to Happy Dollars. I'm sure those envelopes are getting full by the minute. And so if that's happening to you, then just grab another envelope and put in more Happy Dollars. And that we'll see it. And again, if that one gets full, put in more Happy Dollars. Can't collect enough Happy Dollars. Hey, coming up next week, we're going to have the two superintendents from both Unionville High School and Kennett High School, and they'll be doing a presentation for next week's meeting. Don't be sure to miss that. Now we're going to take it out with a special four-way test with Mr. Steve Maley and his daughters, Cailen and Sophie.
Joining us today to lead us through the four-way test are my daughters, Cailen, who's 11, and Sophie, who's 9. I understand they're now minor celebrities based on some recent other performances on this same broadcast, so happy to have them join us again.
First, is it the truth? Second, is it fair to all concerned? Third, will it build goodwill and better friendships? Fourth, will it be beneficial to all concerned?